So we're going to be talking about pulmonary medications.
COPD is chronic obstructive pulmonary disease. It's essentially smoking-induced lung damage. Patients get the disease from many, many years of smoking. Well, what they essentially get is lung damage, and so they have difficulty breathing. And as a result of their difficulty breathing, they tend to lead very sedentary lifestyles, so they tend to shy away from daily activities. That leads to deconditioning and further worsening of their breathlessness. Studies have shown that rehab is one of the most effective therapies at improving health outcomes in COPD. Rehab improves quality of life, walk distance, or exercise tolerance in patients. Importantly, it also reduces how frequently they exacerbate and how many times they end up in the hospital. Studies have actually, even from our own center, have shown that for every $1 spent on rehab, we save about $2 because patients exacerbate less and go to the hospital less. A recent Canadian survey showed that we only have the capacity to serve about 1% of the COPD population with rehabilitation. Further, most of the rehab programs are centered in large urban centers like Edmonton. So because of that, the Centre for Lung Health developed this telehealth rehab program whereby we can deliver rehabilitation services to outlying communities such as Fort McMurray or Grand Prairie.
When I was recovering from an illness and was asked by the university and the College of Physicians and Surgeons to do some continuing medical education to physicians in the country. And one of our topics was chronic obstructive lung disease. And as I reviewed the topic for the physicians, what became apparent was that they did not have access to rehabilitation. Rehabilitation for them would have been have the patient walk a block or two, or maybe get on a treadmill occasionally. But there was no structured program. And so what I discovered in my travels to all the small hospitals was that they all had telehealth. It wasn't being used, but they did have it. And so it was a matter of establishing a center here whereby we could broadcast our telehealth lectures to the country points.
Unfortunately, prior to this program, there really were limited services for these patients. So essentially, these patients were just left to manage their disease on their own or perhaps with their local physician. So this program allowed them to, again, provide rehab and improve their exercise and quality of life.
The program has been very successful, and our studies have shown that the results and outcomes of our urban population match the rural population, and that's critical.